women veterans would like to work with providers that understand military culture,
Right.
that have some sort of framework, because they're finding that providers might not know or have a sense of what that even means or the impact of that, right? And so that's another piece where women veterans are bringing this concern, but having informed providers helps everyone. Having culturally informed providers helps everyone, right?
And I don't say that they can't, because like my primary doctor was not a veteran, but
and
excellent.
Excellent relationship, right? Yeah. I feel you on this.
Yeah.
You know? So, there was another thing I wanted to mention. There's so much to discuss.
Yes.
Well, another thing that this one woman was raising, okay, so she had gone through military sexual trauma.
Mm-hmm.
So she was also talking about specific surgeries that were available for what she called vagina repair and various things like that, that she felt they weren't providing. And they were looking at it more cosmetically than people had been injured through rape and other situations, which needs to be addressed.
Mm-hmm.
So I don't know if you come across that or not, but she wanted me to raise that issue.
Mm-hmm. One of our other partners, because the Women's Health Program really is based on partnerships, is with our military sexual trauma coordinators. And locally we have 2. And the landscape around how VA addresses military sexual trauma has really shifted over the years. It's transitioned from acknowledging, right, defining what counts as MST, educating our providers, but then also the healthcare side and the benefits side kind of converging some about what's covered, right, and being clear about what's covered. And so getting word out, we've partnered with our MST coordinators to help get word out about how all mental health, well, as it stands today, treatment that's related to military sexual trauma is free, right? Regardless of some of the other eligibility requirements, service connection, all of those things, right? And that includes service members that are currently in the National Guard, reservists, right? Whether it happened on a drill weekend or not. So like there's these rules, but our MST coordinators know all the ins and outs of that, because there's little changes that do occur. But for the longest time, word was out that mental health care was free, but not the associated medical care. And that is part of the coverage. And those MST coordinators can help with navigating that. And they're on the website too. The website it's kind of like walking around the VA. It can be confusing.
I know. That's why I usually call.
So that was that flyer. If you go to, oh gosh, sorry, my eyesight. A to Z. And I'm going to the M's. Military sexual trauma. And it's got the names here of our current coordinators, Aisha Crane and Guy Tyler. Okay? And it's got how to reach them. We partner with them to try to help with that, because veterans get co-pays for things that maybe they shouldn't have, or they're trying to negotiate what care is covered and not, and those coordinators can really help. Same thing, we also have an LGBT care coordinator.
Yeah, thank you.
Mm-hmm. We've got 2, right now there are 2, I don't know if this has been updated yet, because we've got new care coordinators. No, it's been updated. Sonia Gainey and Akash Kishore are our current coordinators. And so we partner with them too, right? Looking out for our trans women veterans is also on our radar too.
Those are all issues that were being raised.
Yep. And our trans women veterans are able to access any part of the system based on their identified gender, and that includes inpatient rooms, that includes, their outpatient care, choosing to go to the women's clinic. Those are all available options. Yeah.
And then I've heard women complain about that.
Yes.
At the same time, we had that same within Veterans for Peace,
Mm-hmm.
But the option is we have to understand the diversity and responsibility of not being biased in this situation.
Exactly.
And people understanding.
I think we're in this interesting, I'm going to call it interesting, it can also be very stressful and painful, but period of transition here about how people read publicly, right, versus who they are. So I'll use myself as an example, right? So I identify as Mexican American, cisgender, woman veteran in her 40s, right? But I read as, this is what the world tells me, I read as, I guess, ethnically ambiguous and younger than I am, right? And so people make guesses about who I am and what that means, right? And I think that some of our trans women veterans end up in a similar scenario of people guessing kind of like who they are and what they're about and where their body should be, right? And that's tough. That's tough, right? And I say that because people have made some guesses about where me and my body should be, So we're looking out though for our trans women veterans for sure, because we're looking out for our women veterans. Now, one area that has been tricky specific to our trans women that I'm going to just point out to you here is that, going back to our women veterans section, because one thing locally that we changed is any women veteran who has access to secure messaging on My Healthy Vet, hopefully you all use My Healthy Vet.
I do.
I've never been able to negotiate to navigate it.
Oh no, well I got the person that I can connect you to. Carol Cadallo is amazing.
Okay.
And she wants every buddy possible to be able to be on secure messaging. So if you're on My Healthy Vet for secure messaging, all women veterans have access to email me directly. It's just automatic. It comes up as the Women Veterans Program in Portland, but it goes straight to me. So, because there's some women who aren't able to email their primary care team for some reason, or can't reach the people they're trying to reach, but they can reach me. But here again, here's the problem. Right now, some of our trans women veterans who might be listed in the system with birth gender of male don't have that option in secure messaging, even though they should have the right to email me. Okay, so that's just one tricky area that I'm trying to fix, because I want all women veterans to be able to contact me.
That's
and they can contact me with any systems related issue, right? It doesn't have to be just women's clinic related.
Yeah.
So for sure I wanted to let you know about
No,
that
yeah, that's
piece.
good.
Yeah. Back to this website. On here are things like this call center, 855 VA Women. It's a national call center. Any woman veteran or anyone who cares about a woman veteran can call that line. And if they can't address whatever the concern is on their level, they find the local version of me, whoever's closest to that woman veteran, and I get an email, or that WVPM gets an email. I just got one today from a woman veteran who called this line, and they routed her to me.
And do VSO officers know this stuff too? I mean, they should be trained because they're often working with the veterans to get their benefits, right?
Yeah, ideally they should know about this.
Yeah.
This resource has been around for a while, but also at our Comp and Pen offices in Hillsborough, they have these resources there too, for folks who, at least when they're coming in for their exams, can also be given.
Well, I know for me, when I first started out, and I still can't do it, and that is, I can't fill out VA forms. I need a VSO officer to work that for me, because I don't know what it is. It's psychological problem, because I signed those papers that sent me to war, and the betrayal that I felt from that. That I'm unless I go through somebody that can help me through the process and then I can sign it. But I can't
That's
fill out the
interesting.
paper.
I'm not familiar with it. That's
Yeah. And when I was talking to this other veteran, she was telling me she, through her BTI, cannot function to follow the website
Yeah.
or the bureaucracy. She just can't
yeah.
get through it. She needs assistance to get through it.
No, that's a good point. That e-benefits site, in terms of like putting all that stuff, I know. I just barely set it up and I was like, I can't even. But so this is a resource. Then there's this website that's National Women's Health Services.
Mm-hmm.
And that's just a good website to know like what's the current state of, say, reproductive health. Because we've been getting lots of questions around IVF, right, and other kinds of ways of getting pregnant. But in here you'll find all sorts of things. So here's the infertility treatment options, reimbursement for adoption. It's not that much, but kind of where things are. This is a good, just general resource. Okay. So we tried to put all that on our website so you can have multiple ways of getting info. Like once you get there, that hopefully it would be a resource.
At first, do we have to go to My Healthy Vet to get to this?
No.
Nope, this is on the public facing
No.
Portland. So portland.va.gov.
Yeah.
And so if you go just to the straight up website, which will take you to this page.
You can Google it too, and it'll take you
You
there.
can totally Google it.
Yeah.
Yeah, because it's not intuitive that you would go to healthcare services, women veterans. But same thing, if you go to that A to Z directory, if you go to women veterans there, it will direct you to that women veterans page. Or like you said, just Google it. Now, I realize it's noon, and I want to be mindful of your time, because I just realized now one big question we didn't get to was the impact of Mission Act.
Right.
And I have a short answer that will probably be not satisfying to any of us, which is we don't know.
Right. I figured that was coming.
But
it's good. I needed to hear that too.
yeah, we just don't know. And Women's Health, our program, is acutely aware that most of our care anyways has been in the community. Because of the way it is in terms of maternity care and mammography.
Right.
So some of our gender specific care has already been in the community. And so more of what we're keeping our eye on is that we make it as seamless as possible, right? That we try to make it like less treacherous and difficult. Because one of the things, once we start doing that in-house, out-house care, which is what I've been hearing y'all say, like, I want to keep it in-house because my providers know my history.
Right.
We want to try to keep the communication going so there's not things falling between the cracks.
Right.
That's what we don't want to see happen, right? And so we've already been having our eye on that anyways, but we're definitely paying attention about what this means for Mission Act. And our VA healthcare system is not the most rural, but we're up there in terms of having communities in high rurality areas. And I bring that up because those are the groups that are gonna have to be using community care probably in some cases, and we wanna make sure that
and that was always available when you didn't have the services here. The problem has been is that I talked to people who lived in rural areas. Let's say I knew this guy out in Hood River. He went through TRICARE, and he's a Vietnam veteran, and he's very active politically. Knows our governors and state representatives and stuff, but he said it was hell going through their bureaucracy to get the care that he needed. He would prefer to come all the way into Portland to go to the VA hospital to get his care than to go through that again. And another one that just lived over in Hollywood District had the same problem. And so they have a bit of a fear also of the Mission Act and this push to send people into the other areas. So the question is I know I came, that I called up for an eye exam at one point, and they were telling me they didn't have a space for it. And I knew we had plenty of doctors up there, but I wasn't in any hurry, you know. I have to do it because of my diabetes, once a year anyhow. But they were saying, well, you need to go here. I said, no, I don't. I'm not going to go there. I'll stay here. I don't care how long it takes. I'm not in a big hurry. But you felt like you were being pushed into it rather than given the choice. Now, I was down in Salem when Representative Schrader was doing a forum on the Mission Act.
Right.
And then when I talked with new people that were there working with the state on the contracting it out, they were basically saying that they can't do that. They can't push you. They can only say you have an option.
Right.
People need to know that and be very, very careful about people telling you have to go.
That's a really good point.
Yeah.
And it's the weight tough too. I got cataract surgery this spring, and I had to go outside the VA. And I said, well, why can't I have it in here? I'm willing to wait. And they said, well, the reason we can't schedule you for cataract surgery at the VA is because we have no sterilizers. And it took me a while to get that out of her.
Well, I did ask about that. And in fact, at that moment, they didn't. And they had to hire some new people, but then it was back on again.
It was.
Yeah,
Wow.
yeah. So that actually happened. A friend of mine who's actually a nurse who's doing her training here at the VA she knew the person that was in charge of the sterilization, and she said, yeah, that was actually something.
Oh my gosh.
You know, so it just, and then they filled it. I mean, even the women's clinic at one point, when you said they weren't staffed, I called and talked to people. I also had a TV program in which I hosted, so as a reporter, I was calling as a reporter asking about the women's clinic and why it wasn't being staffed, and then right away they got back to me and said they didn't have the money wasn't being funded. They finally got the funding, and it actually got put into effect right away.
Oh God.
Yeah. So.
Mm-hmm.
So, I mean, it was to me, it's important to ask these questions, to bring these things out so that people are aware of it, but also to say, you know, there's a need out there in the community. We need to fulfill that need.
Yeah, no, I completely agree.
Yeah.
You know, it was part of what appealed to me about being in this role, because like I said, I've been more on the front line of mental health for the bulk of my time here at the VA, and this position had been vacant for a moment. And so, you know, I've now been in this role for almost 18 months now. And so my coming on board was at about the time that the women's clinic was starting to open up and rebuild, and that's so we've been in this kind of rebuilding process. And my expectation is that in this next coming year or so, the fruits of all of this rebuilding will become more and more evident. You know, one of the people we've been working with is at the Oregon Department of Veteran Affairs, Liz Estabrooks. She's another great community partner, and she's pretty vocal. It's one of the things I appreciate about her. And she said, you know, folks like myself in this WVPM role are like the best kept secrets of the VA, and that really is the wrong answer.
That is.
Yeah. I want to be the worst kept secret in the VA, right? And all my colleagues. And so that way you can know, because it's a confusing system anyways, right? It's a confusing system anyways. And so we just want to, again, remove those gender disparities for women veterans, for even just thinking of going to the VA. I don't want it to be so insurmountable seeming.
Right.
Right?
Yes.
So I know there's still some areas for us to cover, because the women's clinic here, in terms of being a safe and inclusive, respectful space for women veterans, which I do believe it is, but we have 12 sites of care. And so we want all our sites of care to be that way.
Right.
And so we're
And how are they working towards that?
Well, all those other sites are integrated, and so separate spaces is not, and actually nationally they've told us that that's not a thing that women veterans have been asking for. They want to have the option to have a standalone clinic, right? But we want to make it family friendly in general.
Mm-hmm.
So some of the things that are going to be coming down in this next year are changing tables in all restrooms. Women's restrooms, men's restrooms, unisex restrooms.
Mm-hmm.
We have a lactation pod, a Mamava, I always mispronounce it. That's at West Lynn. It's a pilot project. And it's our first public lactation room for women veterans. But options like that, to be able to create that safe and inclusive space. You know, that's not just in symbol only. They're also living the values that women veterans and all veterans are welcome in this space, right? So, but we're all ears in ways that we can improve this. So feel free to, you know, return to us with suggestions, ideas from your membership of what you all might see, because I only see things from this side, and whatever angle you all see, maybe we find creative solutions together.
Well, what do you think about putting a program together where we work together and bring people, like some kind of class or forum?
I like that idea. Well, and I couldn't help but wonder too, though, about my enrollment, you know, partners, because they're really great too at trying to understand the benefit side of things. And I know that they have had a woman veteran working in enrollment. She and I partner sometimes to be able to answer women veteran questions in particular.
That'd be great.
We've been thinking about doing a Facebook Live event where me and someone from enrollment field questions.
That would be good.
Do you think that would be of interest?
No, I think that's very important. Yeah.
All right, well, that gives me more fire to make that
happen. It's almost like what do you call them, online conferences.
Yes, exactly. I'm a little behind the times and understanding all that technology.
I just have a kind of something I've been thinking about for some time. Women are aging, men age.
No, we don't.
When things happen to me, I don't know if it's normal aging or if it's something else I have to worry about, or I'm really baffled about this whole woman aging, my personal aging process.
Yeah, and ideally, you know, I think what we would want is ideally to have your primary care provider be a first stop to have a kind of a open and safe discussion about.
That's good,
right?
yes.
Because you're right, our women veteran population, we're actually seeing this bimodal distribution. We've got a younger women veteran population, like late 20s to late 30s, you know, this group. And then we have another group that is in we're actually, the biggest groups are about mid 50s to late 60s is the next group that are highest, right?
Yes.
And we've got to keep our eye on the needs of both of those groups. And the primary care provider is going to be that first step of having that conversation about what is this natural aging? Is this not? Is this a problem? Is this not? You know? And actually, I'm putting a lot on the primary care provider, but I really should be talking about your primary care team, right? And having a team, because that's the other thing that we're really big on, is having a safe team. So a nurse that you can call who can reach your doctor when needed, to be able to, well, I'm saying doctor, but primary care provider, because we have great nurse practitioners. They are amazing. But to be able to go to your team, you know, or like, what does this medication mean? Let me talk to my pharmacist, right? Because we have our women's health pharmacist that reviews meds. So to be able to use your team and have those conversations, because you shouldn't be alone and wondering what's what.
Yeah. Because there's no end to it.
No.